Hello, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today, the topic is 5 things to ask yourself before undergoing elective back surgery. Now, how many surgeries are there in the U.S.? There's over 600,000 low back surgeries each year now in America, and unfortunately, half overall will not obtain the desired outcome. 10% of them, or over 60,000, will actually end up worse than the person was preoperatively. The first consideration is whether to seek a second opinion. Now, having spine surgery is a big decision, and no matter what the undergoing procedure is going to be, and a second set of eyes may be indicated since it is a decision of magnitude. The person may recommend the same surgery, in which case you have that level of comfort. They may recommend that you do have surgery but have something completely different, or a variation of what's being recommended. For instance, the surgeon that you went to initially may do things open with large incisions, and the second surgeon may have a lot of expertise in minimally invasive types of surgery. So it's something to consider. Or the second surgeon may say, you know what, I just don't think you need surgery right now. So it should be something to think about. The second consideration is, have you truly tried all the conservative options available to you? For instance, have you been through physical therapy, chiropractic treatment, maybe spinal decompression therapy, which is an FDA-cleared treatment that's been exponentially increasing in popularity over the last decade, maybe something alternative like acupuncture, medications, either over-the-counter or prescription medication for pain relief. This might not be just narcotics. It may be something like Neurontin or a muscle relaxer, And there's a lot of interventional treatments that can be performed for such things as spinal arthritis. And this may be what you can see here in this picture, which is radiofrequency ablation, where you burn these nerves around the joints of the spine, and that can give pain relief for upwards of 18 months. Might be trigger point injections, intradiscal, medial branch blocks, facet blocks. There's quite a variety of options available. The third consideration should be a true risk-benefit assessment prior to surgery, because no back surgery is risk-free, right? I mean, there's all going to have a risk of infection, some bleeding, potential nerve injury, anesthesia risk, failure to fuse, scar tissue, and the list goes on. On one side of the spectrum is a procedure for something like adult scoliosis, and those procedures in adults are going to have over a 50% complication rate. And then you have something as simple as a laminectomy or a discectomy for a disc herniation, and that's going to have less than a 5% risk rate, but it's not negligible. The fourth consideration is you really do need to have a reality check on the potential outcome that's going to be achieved. Okay, so half of back surgeries, as mentioned, do not end up with the expected outcome. 10% get worse. So you have to ask yourself, if the surgery gets rid of, let's say, half of my pain, is that good enough? Or a year or two down the road, am I going to be upset about that? Because usually it's not a home run. Usually it's like a double, in the analogy of baseball. So one example to think about would be the FDA study looking at this, the artificial lumbar disc replacement. Okay, 2004 they came out with a study that actually looked at these versus spinal fusion. Now, what the disc had to show was similarity to fusion, which is called the gold standard. Okay, it didn't have to show superiority, it just had to show similarity at least. What they showed is that it did work as well as a spinal fusion. However, both groups had at least half of the people who underwent surgery taking narcotics after a year, after surgery. So what that shows you is that even under the best of circumstances, most patients are still going to have some pain after surgery. So you have to really look at what the outcome might be and think to yourself, is that going to be good enough? Okay. The fifth consideration is timing. These are, elective procedures. If it's not an elective procedure, then this whole presentation is not applicable, okay? But so this is elective procedures, and you can deal with the timing. If it's something where you want to take some time off of work, you could take a sabbatical. You could wait for the summer to have it, for summer break if you're a teacher. You can pick the best time for you. You have to take into consideration the rehab that's going to be involved. For a simple laminectomy, it might just be 6 to 8 weeks, to get back to full activity. You may be able to go back to work, within 1 to 2 weeks after a lumbar laminectomy. For a spinal fusion, you're probably looking at about 3 months before you can get back to full activity. Probably half of that at the most to get back to just simple desk jobs. For an adult scoliosis, that's a very long rehab, 6 to 9 months, sometimes upwards of a year, if there's been a lot of inactivity before that. But so you have to keep these things in mind and consider the timing. Okay, it's not a decision to make haphazardly. The bottom line is that the objective is for you to feel comfortable with the decision to undergo spine surgery, even if the surgery does not produce the desired outcome. So it's reasonable to work through these 5 considerations to make sure that it's the right thing for you. It's all about being able to look at yourself in the mirror despite what happens with surgery and say, you know what, I tried everything else, it wasn't working, this pain was just so much, I needed to do something. Okay. The best pain clinics in the Valley is Arizona Pain Specialists. There are 5 locations that take over 50 insurances, providing over 25 treatments, both medical and interventional. Over 90% success rates. They're board certified and award-winning providers who do pain management, chiropractic, acupuncture, spinal decompression therapy, physical rehabilitation, and more. So call today at 602-507-6550 and visit us on the web at preferredpaincenter.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.